Eczema is a skin condition that can cause itching, dryness, scaly patches, and rashes. It's not contagious, but it can make your skin more susceptible to viral, bacterial, and fungal infections. One common viral infection that people with eczema are more likely to get is Molluscum contagiosum. This contagious skin problem causes small itchy bumps, which can be mistaken for eczema. Rubbing or scratching can worsen both conditions. Now, let's take a closer look at the differences between Molluscum contagiosum and eczema. Eczema is a skin condition that experts believe is caused by a combination of genetics and environmental triggers. When your body's immune system overreacts to these triggers, such as irritants, allergens, and stress, it leads to too much inflammation, resulting in the symptoms of eczema. Molluscum contagiosum, on the other hand, is caused by a contagious poxvirus. This infection can spread through skin-to-skin contact with an infected person, touching contaminated personal items, or sharing unwashed clothes or sports gear. While adults can get Molluscum contagiosum, it is most common in children aged 1 to 10 years old. The main sign of Molluscum contagiosum is bumps, but this is just one possible symptom of eczema. Eczema can also cause dry skin, rashes, scaly patches, blisters, crusting, swelling. Babies and young children usually get eczema symptoms on the face, the outside of elbows, and on knees. Older kids and adults tend to get it on the hands and feet, the arms, the backs of the knees, and in the folds of elbows. The condition can show up on different body parts as you get older. Molluscum contagiosum usually brings on small, firm bumps. If you're living with eczema, the bumps tend to show up on dry, affected skin. Molluscum bumps can also irritate the skin, leading to more signs of eczema right around the bumps themselves. Molluscum bumps can show up anywhere on the skin, but children usually get them on their torso, armpits, knees, arms, groin. The bumps rarely show up on the palms of hands or the soles of feet. They can appear on the inside of eyelids, though. At first, molluscum bumps may look pink, flesh-colored, or white. As they get bigger, they start to look dome-shaped with a pin-like dimple in the middle. Once they turn red and look like pimples, it means your immune system is fighting off the virus and the bumps will go away soon. The bumps are often painless. But if you rub, scratch, or pick at them, you could infect the bumps with bacteria on your hands and nails, and that could make them hurt. These habits can also spread Molluscum contagiosum to other parts of your body. If you or your child has eczema and also has Molluscum contagiosum, your dermatologist may recommend treatment. Some options include cimetidine. This liquid medicine is mainly for children and is taken by mouth twice a day for about 3 months. It may taste bad, which can make it difficult for children to take. Cantharidin, a beetle juicia. This treatment is also ideal for young children. A dermatologist applies this medicine to the molluscum bumps, causing a water blister to form on each one. The bumps may then flatten out and peel away over a couple of weeks. Procedures to remove the bumps. These options are typically for teens and adults and may include freezing the bumps off, removing them with a surgical instrument, using a pulsed dye laser, using a scalpel or forceps to remove the core of the bump, or applying certain acids to the bumps. It's important to never try to squeeze or pop a molluscum bump at home, as it could make the infection worse or spread it. So, what can you do to prevent the spread of Molluscum contagiosum and eczema? Here are some tips recommended by dermatologists. Cover the bumps with clothes, bandages, or medical tape, especially when at work or school. Wash your hands with soap and water after touching the bumps, whether it's on yourself or your child. Avoid sharing personal items such as towels, washcloths, bedding, and clothes if someone has Molluscum contagiosum. Make sure the infected person has their own personal items. Before going for a soak or swim, take safety measures to avoid infecting others. This includes covering the bumps with a bathing suit or waterproof bandages, and not sharing towels, goggles, or a bathing suit with others. If you have molluscum bumps on or around your genitals, avoid having sex or making sexual contact until you have received treatment and your dermatologist has given the okay to resume sexual activity. If playing a sport, make sure to cover the bumps and avoid sharing sports gear if you're infected. Consider not playing the sport if there's a chance that the covering could come off. Bathe infected children separately and ensure each child uses different washcloths, bath toys, and towels. Have infected children sleep alone and avoid sharing beds with their siblings.